When it comes to choosing the treatment for erectile dysfunction, often people become very lost and confused due to the large number of options available on the market, as well as the stories that people hear. Some of these treatments may work wonderfully in certain situations while being useless in others. Therefore, in this video, I will share with you 3 stories of my patients who were either cured or significantly helped with their erectile dysfunction. I hope that based on the stories, you will understand which treatment methods to choose for your particular situation as we examine the causes of erectile dysfunction in my patients, how we selected effective treatments, and what results they actually achieved. The first patient is 52-year-old man who presented with complaints of mild erectile dysfunction that persisted for about 5 to 6 months. Upon initial assessment, I found no history of diabetes or any cardiovascular disease. He was a non-smoker with a moderate alcohol consumption, slightly overweight with BMI of approximately 27, and reported a certain increase in work-related stresses. While conducting a thorough examination and running a special panel of lab tests, we found no problems whatsoever. Everything was within normal ranges. Based on recent studies, particularly a Massachusetts male aging study, we know that erectile dysfunction prevalence increases with age and is often associated with various lifestyle factors. Given the patient's profile, I suspected a multifunctional etiology, age-related vascular changes, stresses, and sedentary lifestyle. I also considered possibility of hormonal factors, although his testosterone levels were low but within normal limits. For this particular client, we developed a very comprehensive treatment protocol. First, we addressed the lifestyle modifications. Recent research has shown that increasing physical activity and reducing stress, those techniques can significantly improve the erectile function. Besides increasing irregular exercise activities, I strongly recommended for this patient to start performing pelvic exercise, as well as introduce him to certain types of meditation practices. I've also prescribed this patient certain supplements, particularly Citronex, Vasilmex, and Testagain. The effectiveness of these supplements has been proven by hundreds of our clients who have greatly improved their erection as well as libido. You can also order the supplements directly through our website. The link is in the description. We also incorporated the counseling to address some of the psychological factors, as multiple studies have demonstrated the importance of managing the anxiety and stresses in erectile dysfunction treatment. Over a 3 months period, I monitored the patient's progress with regular follow-ups. By the end of the 3 months period, the patient reported significant improvement in erectile function. His stress levels had decreased, and I observed an improvement in overall health markers. The second patient, 45-year-old man, presenting with progressive mild to moderate erectile dysfunction over the past few years. He has reported using Viagra for the past few years, but for the past 3 months, it did not have a significantly helpful effect. Even though he had no significant medical history, he did report an occasional jumps in his blood pressure, high occupational stress, and regular alcohol consumption, as well as the history of cardiovascular disease in the family. Upon examination and testing, I identified moderate vascular insufficiency and early stages of metabolic syndrome. This actually aligns with the current research that showed that erectile dysfunction often has a vascular component and can be an early indicator of systemic vascular disease. I developed a comprehensive treatment protocol based on recent studies. In 2019, meta-analysis of the Journal of Sexual Medicine showed that extremely promising results for shockwave therapy in the treatment of erectile dysfunction. The protocol I proposed consisted of lifestyle modifications. This included stress management techniques, reduction of alcohol intake, an improved diet, as well as pelvic floor exercises. Number 2, I administered 7 sessions of shockwave therapy for 5 weeks. We combined focus and radial shockwaves. I also prescribed supplements for him, Citronex and Vasomex, to improve and support vascular health, as well as testosterone to increase the testosterone production and improved his libido. As an adjunct, home therapy, I recommended him to use a vacuum erection device. Multiple studies had showed that use of vacuum devices in combination with other regenerative treatments method can significantly improve erectile function and satisfaction in the difficult to treat ED cases. The treatment period lasted 8 weeks, including the shockwave sessions and follow-up with the lifetime modifications and supplements. His results were quite promising, quite honestly great. The patient reported improvement in erectile function, increased spontaneous erections, the morning erections, better response to sexual stimulants, and improved overall sexual satisfaction. Notably, by the end of the treatment period, he no longer required Viagra to get his erections. The follow-up assessments at 3 and 6 months showed that he had overcome the erectile problems altogether, which is consistent with the findings of long-term follow-up studies on shockwave therapy for erectile dysfunction. Patient number 3, 63-year-old man who presented with moderate to severe erectile dysfunction, reporting an inability to achieve or maintain an erection strong enough to have an intercourse. Notably, he had been unresponsive to oral medication like Viagra and Cialis, which he had tried on multiple occasions with maximum dosage. He has type 2 diabetes for over 15-year period and also suffered from hypertension. Both of those problems are well managed by medications. Upon physical examination, we noticed that significant reduction of peripheral sensitivity, peripheral neuropathy, including reducing sensitivity in his feet. A penile Doppler ultrasound report that was ordered previously by his urologist revealed reduction of arterial flow with a peak systolic velocity of less than 25, indicating significant vascular compromise. Now, the etiology in this case was clearly multifunctional. The long-standing diabetes had led to both vascular and neurological complications, which were further compounded by hypertension and vascular disease. This aligned closely with the findings of the Massachusetts male aging study published in the Journal of Urology. This particular study identified diabetes as a significant risk factor for erectile dysfunction, with diabetic men having 3-fold higher risk of erectile dysfunction compared to non-diabetic men. Given a severity of the erectile dysfunction and resistance to the oral medication, we created a very multimodal treatment protocol. We started his treatment with 10 sessions of focused and radial shockwave therapy treatments, performed twice per week for 5 weeks. Once shockwave therapy treatment were completed, patient had 2 PRP injections 6 weeks apart. As an adjunct for home therapy, I recommended the patient to start using a vacuum erection device. We also work closely with patients' endocrinologists to improve the glycemic control, really aiming for the A1C to be below 7. I emphasize the importance of regular exercise and balanced diet, as these can improve both glycemic control and the cardiovascular health. From the very first day of treatment, the patient was prescribed certain supplements, Citronex, 5,000 milligrams, and Vasomex, specifically to improve and support vascular health. He was also prescribed CM Core and Hypolonic for orthomedical products to assist in lowering patients' A1C as well as for weight reduction. We monitored the patient closely for over 6 months. By the end of this period, we had achieved significant improvements. The patient's A1C had decreased to 6.9. He also reported successful intercourse in approximately 70% of attempts using Viagra in combination with vacuum device. 6 months later, 7 more sessions of shockwave therapy were performed. Patient continued his lifestyle changes as well as the supplements regimen, and 9 months follow-up, he reported approximately 90% successful attempts of erection strong enough for sexual intercourse. Now, as you can see with these 3 cases, even if you're developing signs of erectile dysfunction, it's not the end of the world. Modern treatment methods can help you return to normal sexual life. The key is to select the right protocol for you. If you would like to work with us and for us to develop a treatment plan for you, you can feel free to schedule a consultation, a free consultation in our New York office. The link is always in the description. Best of luck to you.